who work tirelessly every day to care for them. We believe the best way to get Albertans the health care they need and deserve is by creating 4 fully integrated provincial health agencies that will oversee the priority sectors of primary care, acute care, continuing care, and mental health and addiction. We have seen the stand-up of Recovery Alberta, which is the mental health and addiction agency already. And today I'm pleased to announce another milestone, the stand-up of Primary Care Alberta. Primary Care Alberta will be the provincial health agency responsible for the oversight, coordination, and delivery of some primary healthcare services. What this means for Albertans is that they will finally have an agency that is dedicated to making sure their primary healthcare needs are met. As it is now, we have the foundations for an excellent primary healthcare system, mostly because we have excellent primary care providers in Alberta. But it can and must be better. Currently, only 4 out of 10 Albertans report being able to get a same or next day appointment with their primary healthcare provider. We are also seeing that Albertans are often unable to access interdisciplinary care, such as linking up dietitians or physiotherapists through their primary care provider because most providers do not work in interprofessional teams. In Alberta, no one organization or authority represents the needs of the primary healthcare sector. That means no one organization is currently accountable for primary health care. This must be addressed, which is why we are setting up Primary Care Alberta. Today, I'm also pleased to announce Dr. Kim Simmons as the new Chief Executive Officer of Primary Care Alberta. Currently, the Assistant Deputy Minister of Strategic Planning and Performance at Alberta Health, Dr. Simmons brings a wealth of public and private sector experience to the role and has extensive experience working with stakeholders across the healthcare system. She has experience working with clinicians and understands the need for data and evidence-based decision-making when it comes to delivering primary care services to Albertans, no matter where they live. Dr. Simmons' first task as CEO of Primary Care Alberta is to make sure every Albertan has improved access to key primary care services, which means more Albertans will be attached to a primary care provider, which may be a family doctor or a nurse practitioner, but no one should be forced to seek primary health care in an emergency department or acute care setting. This work will include introducing new models of primary care, which means supporting the formation of teams of primary care professionals to work together and provide comprehensive health care to each Albertan. Primary Care Alberta will also work to increase access to after-hours care, including options for virtual and digital health where appropriate, because health issues don't just happen during business hours, and I think we all know that. And it will improve access to provincial chronic disease programs to prevent people from falling through the cracks and ensure Albertans have the supports they need throughout their health care journey. Primary Care Alberta was created based on extensive engagement with primary care providers as part of MAPS, the Modernizing Alberta's Primary Healthcare System work that went on and is still underway. Setting up an agency devoted to primary care is a made in Alberta solution. We will actually be the first province in the country to do so. It's a bold move that is needed to ensure Albertans are fully supported in their day-to-day health needs through every stage of life. And I have no doubt that Primary Care Alberta will deliver. I look forward to all the work Kim will be doing in the weeks and months ahead to deliver on the agency's potential. I'd now like to invite Dr. Kim Simmons, the new CEO of Primary Care Alberta, to the podium. Thank you.
Thank you, Minister. And thank you for the opportunity to take on this important role. I'm very excited about this organization, as well as the work that's underway to refocus Alberta's healthcare system. As the Minister has stated numerous times, primary care is the foundation of a solid healthcare system. And it is the first point of contact Albertans have when they need healthcare. and both its strengths and weaknesses reverberate throughout the system. To make primary care in Alberta as strong as it can be, my goal is that Albertans have an ongoing, connected, trusting relationship with a primary care provider, that they belong to a health home where they don't have to tell their story over and over, and that they receive timely and seamless care to other community services to support their overall health and well-being. As the CEO of Primary Care Alberta, I will be in charge of a dedicated organization that supports the governance, oversight, and coordination of primary care services throughout the province of Alberta. The agency will be responsible for supporting Albertans to ensure they have access to high quality, timely primary care services no matter where they live. There have been extensive consultations with primary care stakeholders throughout the Modernizing Alberta's Primary Care System initiative, and great work is already occurring. And these collaborative efforts will continue. I have extensive experience working with stakeholders across the system and understand the need for data and evidence-based decision-making when it comes to delivering primary care services. To that end, I am committed to the ongoing engagement with primary care community as Primary Care Alberta is established. Talking with people in primary care is critical so we can understand the current challenges and work together to find solutions so that Primary Care Alberta supports improvements over the long term. I'd like to thank Minister LaGrange for giving me this opportunity, and I am very eager to get started. Thank you.
Thank you. We'll now open the floor to questions from the media. If you could please state your name and outlet, and we will be taking one question and one follow-up today. We'll start here in the room. Go ahead.
Hi, it's Boisvert, Radio-Canada. How creating this agency will help Albertans get a better access to a primary care practitioner, like in the day-to-day?
On the day-to-day aspect of it,
Mhm.
well, having a CEO that oversees primary care, making sure that we have the right resources, the right facilities, and the right locations, working with the primary care networks across the province, really focused on making sure that we have access across the whole province. That will be part of Dr. Simmons' new responsibility. And so that, of course, is not happening at this point in time, that we have a dedicated agency specifically focused on that.
But how will that help getting more doctors, more primary care practitioner in Alberta? Because that's is still a problem.
Well, so we still have multi-pronged approaches on how we're addressing the needs across the province. We've seen over 287, I believe is the last number that I saw, family practitioners that have moved or are in the process of moving to Alberta that have registered with the College of Physicians and Surgeons just in the last year alone. So that's huge numbers. So we're seeing that. The work that we're doing with the medical residents, the work that we're doing with post-secondaries and making sure that we have additional spaces for family practitioners, the work that we're doing with the nurse practitioner, ability for nurse practitioners now to practice independently in the province and have their own panel of patients. All of these, the pharmacy-led clinics, that should be another one. Again, all of these intersect together, and now it will be Dr. Simmons' responsibility to make sure that we can pinpoint where we strategically need more people and how we can recruit additional supports and resources across the province. So it really is about having someone who's laser focused on making sure that we have just not, family practitioners, but also the whole team that supports a health home for people and making sure that they're available right across the province.
Thank you.
Not sure if Dr. Simmons, there's anything you'd like to add to that?
Hi, Terry from CTV Calgary. I'd like to talk to you about vaccines today with the rollout of the fall immunization
Sure.
program. We're hearing some pharmacies in Calgary still haven't received their COVID shots. Do you know if that's isolated to Calgary? Why, or is it province-wide?
Well, my understanding is that the suppliers that are distributors, a couple of them, or one in particular, has had a little bit of a glitch, but I am assured that they are rolling out the vaccine products, the vaccines themselves, to pharmacies and to the AHS clinics, and will have everyone fully supplied by the end of the week.
What do you know which manufacturer that is then?
It's not a manufacturing issue. I believe it is a distribution issue.
Okay. And my follow-up question is just about the campaign itself. A lot of critics have said that there hasn't been enough, um, sorry, the word's escaping me, but that there hasn't been enough basically of a campaign reminding Albertans that this is the time to get their vaccine clinic. Is this a directive from yourself or from your ministry? Do you share similar concerns?
We spent, approximately $500,000 last year to make people aware of the vaccine and the vaccine rollout and make sure that we reach all people. We're doing the same this year, so that nothing has changed. I just think, people perhaps are looking at it differently, but I mean, it always happens around the same time of year. We continually put that information out, and my understanding was when we spent about $500,000 last year, that was more than double that what was spent in previous years on their rollouts. So we continue to make sure that we get the information out to everyone as quickly and as concisely as we can, and we'll continue to do so. Again, we're not spending any less. We're actually spending the same as we did last year to make sure information gets out there.
Thank you.
Thank you.
Morning, Edward from City News. I was wondering if there was going to be a date in terms of when this new agency will be up and running.
Well, the agency will be up and running by November 1st. But again, there's a lot of work for Dr. Simmons to do. And so we will work closely together to make sure that she's able to start, hit the ground running. I know Dr. Simmons is very energetic and she has a lot of great ideas, and she's a person who is results orientated. So I'm expecting that she'll be hitting the ground running as of today.
And are there any job losses expected between the transfer now from AHS to this new agency?
Well, to talk about any transfers is premature. To say the least, Dr. Simmons has a lot of work ahead of her to set up the agency and make sure that she's connecting with the primary care networks, with the primary care clinics that are happening across the province. There's just a lot of work that she's got ahead of her. So to talk about any transfers is very premature. Thank you.
Hi there, Jordan with CTV News. Last week, Minister, the Premier was asked about homeopathy and alternative care and whether Alberta would provide any coverage for those type of alternative care, something the Premier said that she loved what the questioner was asking. Is Alberta considering providing any type of coverage or support for those alternative care models such as homeopathy?
Well, we'll continue to have discussions with that organization, and I know that a lot of Albertans value the services that they get from homeopaths, but there needs to be a lot more discussion.
What have those discussions looked like so far, and is there any timeline on a possible decision for something like that?
We've met on a couple of occasions thus far. They've put forward ideas and thoughts on what they'd like to see happen. Of course, there's other programs, there's bills that the federal government has put forward that could impact the work that's being done as well. So I would say it's just been in discussion phase thus far.
Okay, thank you. We'll move to the phones. Operator, can you put through our first caller, please?
Thank you. Your first question comes from the line of Janet French from CBC Edmonton. Please go ahead.
Hi there. I was having a look at your report that you released late last week, Shape the Way, Refocusing Healthcare and Alberta Public Engagement. What we heard, one of the response themes from the online survey was to, quote, implement a centralized health system. That's the opposite of what you're doing right now. So how do you plan to honor that feedback that you heard from Albertans?
Well, what we heard a lot from Albertans, and in particular, we did hear, as you say, in that report, that was informed by the surveys and the in-person, et cetera. But what also we heard through the MAPS, which was the Modernizing Alberta's Primary Care System engagement sessions, was that we need oversight of the primary care whole continuum of care within primary care, because that has been lacking. And so to have the ability to have oversight of primary care is essential to moving things forward within the system. So that's something that we heard loud and clear on numerous occasions.
Do you have a follow-up, Janet?
Sorry, my mute button got stuck. I was also struck by the systemic barriers this report says Indigenous people face when they're trying to access healthcare. So your report says, quote, systemic racism within Alberta's healthcare system affects service levels both consciously and subconsciously, leading to lower quality or inappropriate care for Indigenous people due to stereotypes and biases. So first of all, I wanted to know, do you agree that there's systemic racism in the healthcare system, as this report indicates? And can you explain to me how this restructuring is tackling that issue in specific?
Well, and again, that is what we heard from individuals themselves as they've tried to access the system. I would say what we are doing for the first time ever, I have an Assistant Deputy Minister of Indigenous Health that is working very diligently with Indigenous communities across the province to look at how we can address these very issues. We also had, when we had the Modernizing Alberta's primary care system, we also had Indigenous modernizing primary care engagement as well. And we did hear through that they feel strongly that they do suffer from racism and acts of discrimination. And so we are tackling that. We've got numerous projects already on the go, including patient navigators, looking at anti-racism toolkits, doing more education, et cetera, culturally appropriate care in facilities and areas where we have a lot of Indigenous individuals seeking care. So there's a lot of steps that we're looking to address that, but that is what we heard from them, that they do feel that there is racism within the organization.
Operator, can you put through our next caller, please?
Your next question comes from the line of Graham Thompson from Toronto Star. Please proceed.
Hey, Minister, it says Graham Thompson. Regarding this primary care, how much will this cost, this new system, and how will you pay for it?
Well, primary care already has some structures in place, but they're not integrated. So we do have primary care networks. We have obviously physicians who have their own clinics. We have a number of other programs that, like 811, et cetera, that operate. There's a lot of systems that we already have in place that need to be better coordinated and actually integrated with the overall system as well. We are looking to stand this up. We already know that there are dollars allocated even within Alberta Health Services budget for primary care, even though that it wasn't one of their main focuses. So again, we're looking at how to resource this, but we are continuing to make sure that Dr. Simmons has what she needs to set things up.
Okay, I have a follow-up. Can you hear me?
Yes, yeah, go ahead.
Yeah, okay, yeah, sorry. And a second question, Minister, is this came out over the summer. There's free hockey tickets in Sam Rach. Just wondering, did you take any free hockey tickets? And speaking of Sam Rach, is he doing any other business with the Alberta government, Alberta Health? I've heard he's actually got a surgical clinic in Edmonton.
I did not go to any of the hockey games, the regular season or the playoff season. So I can assure you of that. And I'm sorry, I didn't quite hear the full question.
The last part of the question is, one of the issues, of course, came up with that hockey, the tickets is Sam Rach, of course, with MH Care. And I was wondering, he did the so-called Turkish Tylenol deal, he's involved in that. But is he involved in anything else with the Alberta government or Alberta Health? Because I've heard he's got a surgical clinic in Edmonton. My question is the government, Alberta Health, whatever, doing more business with Sam Rach? I
am not familiar with that individual, to tell you the truth. And I am very much in favor of making sure that that we work with providers that, if they actually put an RFP in and they win the RFP, that everything is done above board. So I am not sure on that individual, but we have Alberta Health Services and Alberta Health continue to make sure that we provide services to Albertans and that the processes that are in place are followed.
Thank you,
Period.
Graham. Operator, next caller, please.
Your next question comes from the line of Jonathan Bradley from Western Standard. Please proceed.
Hello, Minister LaGrange. Thank you for taking my question. So you spoke about how you want Primary Care Alberta to become operational later this fall, but there remains a ton of work to be done for that to happen. What do you anticipate being the largest challenges to setting up Primary Care Alberta?
Well, there's a lot of individual clinics. There's primary care networks that already function across the province. We have a lot of integrated services that could be better integrated. And so I would say there's just a lot of work that needs to be done to just make sure all of those pieces come together and function under the new primary care banner. I know Dr. Simmons probably has put some thought into this as well and would probably like to share a few thoughts as well.
Thank you for the question. I think one of the most important things we need to do is make sure that we can take all of those pieces of the puzzle and put them together so that we build the right collaborative structure for governance to be able to work together. One of the real strengths of this is having a dedicated organization that focuses on primary care, which is the foundation of the healthcare system, and I fundamentally believe the most critical piece of healthcare. And so making sure we can bring people together, that we can have a common understanding of the goals we're working towards, and that we can set up really strong governance so that there's the ability to share information back and forth between the system is going to be, the very first thing that we need to set up. And then after that, of course, there's all of the to-dos to roll out the strategic plan to make sure that people have access to timely care, that we have a chronic disease management system that works really well, that we have interoperative health systems so that your health record goes with you. So there's 1,000 pieces that need to go, but the first piece is that we need to make sure we have all the pieces of the puzzle and that we can collaborate together in a trusting way so that we can set up strong governance to move forward. I hope that answered your question.
Okay. And my follow-up pertains to Kim Simons being appointed as the Chief Executive Officer of Primary Care Alberta. So, Minister LaGrange, why did you feel Simons was the best choice to become PCA CEO?
Because she has excellent skill sets. She's results orientated. She's got a long history of working within the healthcare system. I think I'll turn it over to Kim to share some of her background and what she's been able to do in the past.
Thanks again. So I love to do things and I love to solve problems. So I have said that I'm a failed academic and a failed public servant, but I don't think that's the way to say it. I have worked in academia. I've worked doing research. I've worked actually with Alberta Health Services when it was created to set up surgical site infection programs. So I've worked all through the system. I've worked in rural Alberta. I've worked in Calgary. I've worked in Edmonton. So I bring a wealth of different perspectives on the system, but I think fundamentally, as the minister pointed out, I love to be able to check off a to-do list, and I love to be able to show results. And there's really nothing I'd like more than to show Albertans that we can have the strongest primary health system in the province. Does that answer your question? I feel like I'm in a job interview. Okay, thanks.
Thanks, Jonathan. Operator, can you put through our next caller, please?
Your next question comes from the line of Jennifer Lee from CBC News. Please proceed.
Hi, thanks for taking my question. This one is for the minister. Minister, your government has been criticized for not announcing a new payment model for family doctors by September as promised. I've heard, I think you mentioned earlier a November 1 launch for this organization, and I'm wondering how can the work with this new primary care organization proceed without having that piece of the puzzle in place? And when do you expect to announce that new payment model?
Well, and just to clarify that, we did have an agreement with the Alberta Medical Association on all physician compensation that was signed just 2 years ago. So the negotiations that we've been doing on developing the new physician primary care compensation model really is off the regular cycle of negotiations with physicians. The original agreement that we signed was a 4-year agreement that was signed 2 years ago for all physicians, of which family physicians, primary care physicians received a 5% over 4-year increase. So this new model is really to, again, recognize that family medicine, that primary care, rural generalists really are experiencing additional issues and concerns that need to be addressed. But I also want to remind everyone that just last November, I also dedicated an additional $257 million to stabilize primary care while we were working towards the new model and bringing that forward. And so 157 million of that has been already allocated out to family medicine in this year, and there's another 100 million allocated for next year. So as we continue to support primary care, and as Dr. Simmons has already mentioned, there's a lot of work that has to be done with a lot of healthcare professionals, including primary care physicians, to make sure this new agency gets up and running. So she'll be working closely with clinics and primary care networks and all of the other allied health professionals that are involved in primary care.
Just to follow up on that, that model that we're talking about here, you had said would be announced in September. That didn't happen. You're now proceeding with this launch of the primary care organization. So what does that mean for the timelines for announcing that new model? When can it be expected?
Well, and I'll just remind everybody what the time frames of what I'd agreed with the AMA on was that last November we signed a memorandum of understanding that we would work towards developing new compensation model. In the spring, we announced that we had actually come up with the framework for a new model. It had to go to rate review. That rate review, after it was done, was coming to myself here in the fall. I believe we're still in fall. And so there's work to be done. It has to go through a number of steps, including Treasury Board, which also has to be done because we want to make sure it's sustainable. I think I've shared examples in previous interviews where we had, as a government, allocated millions of dollars to setting up IT systems. And I'll give you an example, the blended capitation model. And, after that was set up, when we had spent millions to set up the IT, only 18 doctors, I believe it was about 18 doctors, actually signed on to it. We want to make sure that this model is successful, that in fact will do what we want it to do, and that it will in fact, have many doctors. So there's roughly about 5,000 physicians that are family practitioners. We would like to see the majority of them sign on to it. So we want to make sure it's successful.
Operator, next caller, please.
Your next caller comes from the line of Jack Farrell from the Contingent West. Please proceed.
Hi, I'm not sure which question or who would be best to answer this question. Sorry, but I am curious. Will Primary Care Alberta be public facing when you say that this organization will be accountable for primary care, accountable to the public, or will Primary Care Alberta be more internal facing and the organization focused on working with the primary care networks? What side of that is this organization on?
It will be both. There will be a lot of work that happens behind the scenes, but there will also be a public-facing website, et cetera, that we'll share with Albertans as we move along the continuum. I really believe it's important for us to be transparent and to be able to share the, what's happening and make sure that Albertans know. I know that Dr. Simmons probably has some ideas in terms of how we can better utilize technology as well to make sure that it's integrated across all of the healthcare continuum, and that we are able to, primary care still needs to be able to intersect very closely with acute care, continuing care, and of course, Recovery Alberta as well. So there's a lot to be done behind the scenes, but there's also a need to make sure that there's a public-facing website and communication. Is there anything?
And then
Ted?
as a follow-up, I'm
Sure.
curious, like you both said today that, primary care is like the foundational level of healthcare. And because it's so foundational, I'm kind of struggling to connect how this organization will operate differently than AHS. Like, obviously, since primary care is such a foundational level of healthcare, AHS certainly wasn't ignoring it, I'm sure, unless, you have something to say differently there. But how exactly will this organization operate differently and essentially, like, do better than AHS is doing? Like, how exactly will this organization do better?
Well, Alberta Health Services really has a lot of different areas that it is focused on. And primary care, while it did supply some of the clinics that are out there and some strategic areas, it didn't focus on primary care. And so what we were hearing from primary care networks and from clinics, et cetera, and allied healthcare professionals across the province, particularly when we did the Modernizing Alberta's Primary Care System engagement, which was really quite extensive, was that we needed dedicated leadership that was really focused on primary care. And that has not been happening at the Alberta Health Services level. And so, as even Alberta Health Services transitions to being an acute care provider, very focused on making sure that they provide excellent acute care, we need to make sure that primary care is not lost or forgotten. And that's why we have a dedicated agency for primary care.
Okay, thank you. We're going to move on to our final caller. Operator, can you please put them through?
Your next question comes from the line of Alana Smith from Globe and Mail. Please proceed.
Hi, thanks for taking my question. Can you hear me okay?
Yes.
Awesome. So I just wanted to go back a bit to the annual vaccination campaign, obviously with flu shots being available today, and I'm assuming COVID-19 boosters as well. Will AHS be doing its annual media availability and press release today? And will AHS be allowed to speak with media with their healthcare professionals about immunization effectiveness?
You know what? I would assume that they would be doing what they typically do. We have, I continue to meet with the CEO of Alberta Health Services, but the discussion around immunization has always been making sure that we have the product at the clinics, the AHS clinics, as well as the pharmacies, et cetera, available, and that Albertans were able to book their appointments. And I anticipate that Alberta Health Services will do their media avails as they typically would.
Maybe a follow-up on that then. Last year we had revealed in the Globe and Mail that the government had actually ordered AHS to remove references to specific vaccines in last year's vaccination campaign. Also that the government instructed the health authority to limit information on vaccine benefits, also on vaccine efficacy. And so I guess I'm wondering, I know you said, AHS will do what it does, but AHS has also been directed by the government to do certain things as it relates to the immunization campaign. So what direction, if any, has the Alberta government given AHS this season when it comes to the immunization campaign?
Well, Alberta Health Services on a regular basis reviews its processes and its communications. In a post-pandemic, everyone is looking at making sure that respiratory virus season incorporates all the respiratory viruses that are out there, including flu, including RSV, including COVID. And so the changes that Alberta Health Services has made has been in consultation with a lot of their expertise within their organization and within Alberta Health to look at what are the viruses, what are the strains that are going to be most prevalent in this upcoming year, and how do we address those, and how do we make sure that we have capacity within our acute care system should we need it, because typically we do see more individuals coming to our acute care system, utilizing our acute care system through respiratory virus season. So I know that they've added additional surge beds, and they've added additional staff, or in the process of adding additional staff to make sure that those beds have staffing that go along with them to meet the demand that we see every single year. And so again, post-pandemic, we're looking at all respiratory virus season, including all of the viruses that are out there.
Okay, and we'll end it there. Thank you, everybody.
Thanks, everyone.